There's basically two ways to carry out a rhinoplasty. One is called the endonasal or the closed approach, and the other one is the open approach. Depending on the patient's concerns will depend on the approach to the nose. Cosmetic surgery of the nose is probably one of the more complicated procedures we do in cosmetic surgery. So it is very important to be able to visualize the structures as I go ahead and dissect what I am ultimately going to deliver for that patient. When I do a consultation with the patient, I'll use a program called TouchMD in which their photograph is actually placed on a screen. It's a touch screen so that I am then able to draw exactly what the planned procedure will be. If along the way the patient has some questions, having their picture up on a screen is always helpful because I can address each of their concerns. Following their procedure, the patient is going to go home. They usually go home with a splint over their nose and some packing inside the nose. There usually is no pain associated with this procedure, so their requirement for pain medication is minimal. There will be, however, some swelling and some bruising which occurs. They'll go home. The next day they'll come to the office. I will then examine them and remove the packing that's inside the nose. The splint will stay on for about a week. During the ensuing week, swelling will start to diminish. At a week, I will go ahead and remove that splint, retape the skin to the shape that we want it to be in, and then have the patient follow up with me 1 month later.